Infant mental health and early attachment. Introduction to the module. This module will discuss how an infant develops their relationships mentally with parents or caregivers. Topics to be covered: infant mental health, attachment types, secure attachment, insecure avoidant attachment, insecure ambivalent attachment, disorganized attachment, supporting parents to build attachments with their babies, identifying risk. Infant mental health. Health is the basis for a good quality of life, and mental health is of overriding importance in this, as stated in Article 24 of the United Nations Convention on the Rights of the Child. Bright Futures, Mental Health Education 1999, a multi-agency inquiry group, states, children who are mentally healthy will have the ability to develop psychologically, emotionally, creatively, intellectually and spiritually. It is widely thought that at any one time, 20% of children and adolescents experience psychological problems and that the incidence may be higher in densely deprived inner-city areas of the UK. In 2006, Reaching Out, an action plan on social exclusion, a government initiative, recorded that pregnancy and the first few years of life are crucial, and that intensive health-led home visiting during pregnancy and the first 2 years of life can radically improve outcomes for both the mother and child, particularly in the most at-risk families. The report states that early childhood circumstances can cast a long shadow and places appropriate emphasis on the need for practitioners to be aware of how important a child's early experiences are to the development of the brain. The report further asserts that the child who is nurtured and loved will develop the neural networks which mediate empathy, compassion and the capacity to form healthy relationships. Recent research on the brain has found that, even prenatally, a baby's brain is affected by environmental conditions, such as nourishment, care, surroundings and stimulation that the baby experiences. A lack of sensitive, critical nurturing experience and excess exposure to trauma, such as violence, will alter the developing central nervous system, predisposing the infant to become more impulsive and reactive with a risk of developing violent tendencies. Neglect in early childhood alters the physical and functional development of the brain. The first few months of life are a sensitive period when children develop attachments and learn about emotions and social interactions in their family. This lays the foundations for future social, emotional and cognitive development. Children who do not have secure relationships early in life are at greater risk of significant mental health problems, educational difficulties or conduct disorders. An infant's early experiences in relation to his or her relationship with the primary caregiver affect the development of the neurobiological structure of the brain, and it is likely to be difficult to alter the hardwiring when negative experiences have endured. Attachment types. Secure attachment. Secure attachment is a protective factor, which confers confidence and adaptability, and provides the best-known psychosocial precondition for tension-free playful exploration. Children who display a secure attachment pattern are generally more enthusiastic and persistent with tasks and are more sociable, cooperative, and resilient. It is widely thought that about 65% of all infants are securely attached. A secure child is able to explore the unfamiliar environment but frequently returns to mother. Cries when the mother leaves the room and greets mother with pleasure when she returns. Is easily comforted when the mother returns. Securely attached children are best able to explore when they have a sense of having a secure base to return to when they might need reassurance. When they are reassured through this secure base, this bolsters their sense of security and develops the child's resilience, educating the child how to cope with the same problem in the future. A child becomes securely attached when the parent is available and able to meet the child's needs responsively and sensitively. The primary caregiver, usually the mother, intuitively recognizes the infant's cues and identifies the expressed needs through the infant's behavior and communication. Insecure avoidant attachment. Sometimes classed as anxious avoidant insecure attachment type, This attachment pattern is displayed by a child who avoids or ignores the parent, showing little emotion when the parent departs or returns. The child will not explore very much, regardless of who is in the room. The child would treat the stranger in this experiment no differently than the parent, as they will not express any significant emotional communication. This attachment pattern is developed from receiving a disengaged parenting style, where a child's needs are frequently unmet, and based on this experience, the child believes that they do not affect communication of need. An insecure avoidant child explores new environment without checking on mother's presence. It appears not to be affected when a mother leaves. Avoids looking at or coming close to mother when she returns. Insecure ambivalent attachment. This is also known as an anxious resistant insecure attachment style, and a child displaying this attachment pattern is anxious about exploring and of the stranger, even when the parent is present. When the parent leaves the room, the child becomes extremely distressed and will display ambivalence when the parent returns, seeking to remain close to the parent but resentful and resistant when the parent offers attention. This pattern of an attachment may be a result of conditional parenting when the parent is engaged, but on their own terms. Sometimes the child's needs are not met, and at other times, attention is given through the parent's own need rather than through the child initiating a need. An insecure ambivalent child clings to mother, afraid to explore the new environment. Extremely agitated and cries non-stop when mother leaves. Seeks contact when mother returns. Resists all efforts to be soothed. Disorganized attachment. This pattern of attachment is displayed by a lack of a coherent pattern for coping. The ambivalent and the avoidant styles are not effective, they are an organized way in which a child views the world and deals with it. It is suggested that children with a disorganized attachment may experience their caregiver as either frightening or frightened. A frightened caregiver is alarming to the child, who uses social referencing techniques such as checking the adult's facial expression to ascertain whether a situation is safe. A frightening caregiver may be aggressive towards the child, putting the child in a situation of having fear without a solution. The caregiver is the source of the child's alarm and their haven of safety. Through parental behaviors that are frightening, the caregiver puts the child in an irresolvable paradox of approach avoidance. This paradox may be one of the explanations for some of the still and freezing behaviors observed in children who are thought to have a disorganized attachment. Children who display a disorganized attachment pattern are most at risk of developing severe problems, including aggression and conduct difficulties. It is also likely that these are children who might be at risk of abuse. A disorganized child exhibits a diverse array of conflicted behaviors. Rocks on hands and knees. Avoids eye contact. Moves away from the parent, leans on the wall when frightened. Rises to meet parent, but then falls. In a nutshell, children who have a secure attachment learn basic trust and reciprocity. Learn self-regulation. Develop a good sense of self-esteem and self-worth. Have a sense of right and wrong. Develop empathy and compassion. Develop resilience. Enjoy healthy brain development, leading to positive cognitive function. Achieve academically. Develop an ability to make and sustain long-term relationships. Supporting parents to build attachments with their babies. When parents recognize their infant's communication, it enables them to reciprocate positively. New parents may need support in understanding how babies communicate and how they might use nonverbal cues to express their feelings. Less than sensitive interactions tend to break down into three fairly common patterns. The most common of these is the inadvertently intrusive and controlling parent, who can overwhelm an infant. The second of these patterns is that of a passive parent who appears preoccupied. This can often be a sign of postnatal depression. The third pattern is a mix of intrusive and passive, leading to unpredictable parenting. Several studies have identified the effect of postnatal depression on the relationship between the mother and baby. Health visitors and midwives have a key role in observing the cycle of reciprocity between a baby and mother and giving the mother feedback on how they are responding to the baby's communication. Some good practice points involve: encourage parents to recognize their child's uniqueness. Children have their distinct likes and dislikes and have already begun to establish their personality at birth. Encourage parents to enjoy some time every day, focusing just on the baby. This might be when the parent meets the baby's daily needs, such as bathing or feeding them. It is important to ensure that the parent's focus is entirely on the baby at this time and that they are not distracted. Infant massage is an extremely beneficial way of relieving stress for both mothers and babies, and this might be incorporated into a baby's daily routine. When parents recognize their infant's communication, it enables them to reciprocate positively. New parents may need support in understanding how babies communicate and how they might use nonverbal cues to express their feelings. Health visitors and midwives have a key role in observing the cycle of reciprocity between a baby and mother and giving the mother feedback on how they are responding to the baby's communication. Identifying risk. Factors that cause risk are: child factors, the genetic makeup of the child, likelihood of low IQ or learning difficulties, chronic physical illness, developmental uncertainty or delay, communication difficulties, temperament, for example slow to warm up, low self-esteem. Family factors, poor parental mental health or postnatal depression, overt parental discord or domestic abuse, family breakdown and or other losses, bereavement, inconsistent or unclear boundaries, with contradictory parenting styles, hostile or rejecting relationships, parental inability to adapt and respond to an evolving change in child's needs, parental substance or alcohol misuse that renders family lifestyle chaotic, criminality in family, hostile or abusive parenting style. Environmental factors, homelessness, poverty, discrimination, unemployment, lack of local child-focused facilities. Observation of children is an informed way of assessing, which supports practitioners in raising awareness and a better understanding of children's mental health. When carried out carefully and holistically, observation supports practitioners in noticing children's communication in a systematic way. Furthermore, there is little evidence of health practitioners such as pediatric nurses and health visitors receiving adequate information during their professional training on children's mental health. A holistic approach to assessing a child's mental health should incorporate all aspects of their life. Assessment criteria should include child's generic details, including name, date of birth and address. Family genogram, stating a basic outline of who is in the family and the context in which the child is part of the family. The genogram includes a history of the parents' relationship and includes siblings. It also includes information about the extended family, if there are significant family members involved, and in cases of separated parents, information is included about any relevant contact details. The genogram is used routinely in family therapy and as a structured way of gathering information that is specific to a child. Child's behavioral patterns, compliance and ability to respond to boundaries. Where a child is presenting with challenging behavior, it is important to get specific information about how the child expresses emotional distress. Child's developmental history, including circumstances at birth and in the neonatal period. The temperament of the child. Routines of the family and child, for example mealtimes and bedtimes, and how the child responds to these. In young children, difficulties around feeding, sleeping and toileting are often emotionally related. Environmental factors need to take into consideration home circumstances as well as support networks available to the family, specifically in relation to the child's mental and emotional well-being, including the availability of appropriate safe play spaces and the impact on the child when negative community pressures affect the family, for example homelessness or racism. Parental factors consider parenting style and relevant history, such as parental discord, parental learning difficulties, domestic abuse and lifestyle implications, for example alcohol or substance misuse on the child's mental health. Parental mental health has a significant impact on the mental health of infants and children. It is estimated that children of depressed parents are up to 5 times more likely to develop behavior problems than other children. Summary. In this module, we learned. It is widely thought that at any one time, 20% of children and adolescents experience psychological problems and that the incidence may be higher in densely deprived inner-city areas of the UK. The first few months of life are a sensitive period when children develop attachments and learn about emotions and social interactions in their family. Secure attachment is a protective factor, which confers confidence and adaptability, and provides the best-known psychosocial precondition for tension-free playful exploration. When parents recognize their infant's communication, it enables them to reciprocate positively. A holistic approach to assessing a child's mental health should incorporate all aspects of their life,